Hi, hello and welcome. Today we are going to see in detail about atrial septal defect in a pediatric aspect. So if you find this page useful, kindly like it, share it and subscribe it. So what is cardiovascular system is? The cardiovascular system consists of the heart, which is a muscular pumping device, and a closed system of vessels called arteries, veins, and capillaries. The vital role of the cardiovascular system is maintaining homeostasis, depends upon the continuous and controlled movement of the blood through thousands of miles of capillaries and permeate every tissue to reach every cells in the body. So physiology is the deoxygenated blood from the body returns to the right atrium of the heart through a superior and inferior vena cava. The right atrium contracts, pumping the deoxygenated blood through a tricuspid valve into the right ventricle. The right ventricle contracts, pumping the deoxygenated blood through a pulmonary valve into pulmonary artery. The pulmonary artery carries the deoxygenated blood. The blood becomes oxygenated and returns to the heart through a pulmonary vein. The left atrium contracts, pumping the oxygenated blood through a mitral valve into left ventricle. The left ventricle contracts, pumping the oxygenated blood through a aortic valve into the aorta. The aorta carries the oxygenated blood to all the rest of the parts of the body. So this is the what we have discussed in the theoretical aspects in the previous slides. It is being explained in the GIF images, that is how the deoxygenated blood becomes the oxygenated blood and how it goes to rest of the body through how the purification of blood takes place is being explained in detail. So we are going to see the defects of cardiovascular system, especially we will discuss about atrial septal defect. So cyanotic, a cyanotic heart disease that deprives of oxygen from the, it is a congenital disorder. So some of the cyanotic heart diseases are truncus arteriosus, transposition of great arteries, tricuspid atresia, tetralogy of Fallot, total anomalous pulmonary venous retain. So this is the cyanotic cardiovascular disease condition. So next we will see about the acyanotic cardiovascular dysfunction. So in acyanotic, the heart disease defects that affects the normal flow of the blood. So some of the acyanotic are ventricular septal defect, atrial septal defect, patent ductus arteriosus and coarctation of aorta. So we will see only the atrial septal defect in this video. So atrial septal defect is a congenital heart defect in which the wall that separates the upper heart chambers, that is atria, does not close completely. So that causes the mixing of oxygenated and deoxygenated blood. When there is a mixing of these two bloods, there leads to a cyanosis in the body due to the deficient amount of oxygen being supplied to all parts of the body. So you can see in the image how the mixing of blood takes place, that is mixing of both oxygenated and deoxygenated blood leading to cyanosis of the body. And next we'll see about what are the causes. The ASD is not very common, but atrial septal defect is a structural problem that develops when the baby is inside the womb itself. So some of the genetic causes, certain medical exposures or environmental exposures, and lifestyle modifications like smoking and alcohol misuse. So what are the symptoms the baby will exhibit is difficulty in breathing, that is dyspnea, frequent respiratory infection in children, sensation of feeling the heartbeat, and like when you run you will feel the heartbeat, no, that will be very prompt in the babies having atrial septal defect. So next clinical manifestations is shortness of breath with activity. When they even do a small activity causes the shortness of breath. Frequent respiratory infection, tiring when feeding. Even as feeding causes the infant to have a tiredness, shortness of breath, and skipping of heartbeats may also be felt, and a sense of feeling of the heartbeat will also be felt by the infant or the baby. Next is diagnostic evaluation is cardiac catheterization, chest x-ray, coronary angiography, electrocardiography, echocardiography, magnetic resonance imaging, and transesophageal echocardiography. So we will see these diagnostic evaluations in a separate video one by one in detail. So what all these diagnostic evaluation is known as. Next is complication. If we do not do a prompt treatment or prompt diagnosis, it may lead to complications such as arrhythmias, particularly atrial fibrillation, heart failure, pulmonary hypertension, and even it may lead to a stroke. So prognosis, when we identify the disease, that is atrial septal defect, in a very earlier stage, we can do a prompt treatment to the baby, either medically or surgical interventions can be carried out, and the baby will have a good prognosis of the disease. So we have to identify with the help of signs and symptoms of the babies. So medical management is, you have to administer furosemide 1 mg per kg per BD and digoxin 5 mg per kg per BD and potassium chloride 1 mg per kg per BD. If we are not if the baby is not going to get cured by the medical management, you can also go with the surgical closure like cardiopulmonary bypass, pause string closure and knitted Dacron patch. So next is nursing management. Identify the symptoms, that is like breathing difficulties, everything, and breathing difficulty during the activity. This all can be identified with the symptoms. Carry out all the investigation. Monitor the potassium value, which is very essential in a disease conditions like cardiovascular system. Intake and output chart should be identified. So that's all the video is. So this is a simple term about atrial septal defect. If you find it is useful, kindly like and share. Thank you.